Hello guys, welcome to Fellow TV Kenya. Today we are privileged to have one of our specialist oncologists in one from MTRH. Just as we said the other time that we will have shows that will be running in our Fellow Media Service channel, that is Fellow TV Afya, and we will be dealing with cancer, because cancer, most of the people have been complaining, have been suffering through this kind of disease, and today we want to know what are some of the things that, as our esteemed audience, that you should do, and what are some of the things that you should get to know about cancer and cancer-related diseases, so that you can be able to deal with them, or if you have been affected in one way or another, you will also know some ways to cope with the disease. Now, welcome to our Fellow TV channel, and here with me I have a co-host. Just do some introduction so that we can invite our guest.
Welcome so much. My name is Dr. Collins, representing Fellow Media Services. Thank you.
Welcome. Now back to you. I want to now launch officially the program of today, that is Fellow TV Afya, and just as we have said, we have an oncologist. I want to welcome her so that she can choose some brief introduction. Welcome. This is Fellow TV Kenya, and we are privileged to have you in your office.
Thank you.
Okay. Now, can you briefly have a moment and just introduce yourself to our audience?
My name is Dr. Auma Obuya. I'm a practicing clinical oncologist at MTRH Eldoret.
Yes.
Yes.
Thank you. Welcome. Thank you, and thank you for your introduction. Now, shortly after introduction, kindly we want to allow you to give us a brief introduction about, maybe there are some of our listeners, some of our followers who don't know what cancer is. You know, there are some who have no idea about cancer. Can you briefly give us information on cancer and the latest advancement in treatment of cervical cancer, breast cancer, prostate cancer, and other related diseases?
Okay, so cancer is a disease, and it is a chronic disease that is mainly happens because of what we call mutations. And when I say mutations, I mean that all of us have things called DNA that is arranged so well in a very precise manner. So just alteration in a protein or in an amino acid can send the signal to what we call the cell cycle, so that the cell cycle continues perpetually. When the cell cycle continues perpetually, the cells reproduce and then they grow. That is called cancer. Now, that growth can be what we call benign. Benign means it's harmless, they are multiplied, they are not rogue, you know. They're just there. So you see a swelling or something like that. But now cancer is when now that growth is chaotic. It's chaotic, it's unruly, and it spreads very fast. So you find that it could leave an organ of origin and go to the next organ like that, until eventually you come down with multi-organ failure. And eventually that is what kills you. Yeah.
So you talked about cancer being a chronic disease, yeah? So what are the most common symptoms when it comes to cancer and the risk factors associated with cervical cancer, breast cancer, and prostate cancer?
Well, you cannot say there's a symptom that is associated with cancer, because there are many cancers. We have lots and lots of cancers depending on tissues of origin. For example, if you talk about breast cancer,
Yes.
there is a famous mutation called BRCA1 and BRCA2. Individuals that have that running in their genes have almost a 20 to 30% chance of developing cancer in their lifetime. Okay? And we also find women who have not breastfed for one reason or another, they have not given birth, women who are obese, exposure to radiation. If at an earlier age you were exposed to one form of radiation or another, chest wall radiation, you have a predisposition towards getting breast cancer. When you go to prostate cancer, it's also heavily genetic. You have genetic aberrations that interfere with the DNA formation and propagation. And once that interference happens, the prostate cells are perpetually instructed to multiply. That is how you get prostate cancer. But other things are associated like obesity, sedentary lifestyle, heavy consumption of red meat, popularly known in the country as nyama choma. That black thing around the red meat is not good for you. And then when you come to cervical cancer, cancer of the cervix is the mouth of the uterus. The uterus is what is known in common terms as the womb, where fertilization takes place and the baby grows. So you have its mouth, and that mouth is called cervix. And it can also have crazy growth of cells around there, resulting into cancer. The commonest cause of cervical cancer is viral in nature. It arises from a virus called human papilloma virus, HPV. With a very high prevalence in this country, and that's why cancer of the cervix is one of our top killers of women in the country, and actually in most of the developed undeveloped countries. So that is the reason why even there is a very heavy campaign of vaccination against HPV. In fact, there are some nations in this world that have completely eradicated HPV, and they hardly see any cervical cancer. One of them is Australia, because of that campaign of human papillomavirus vaccination. So the interesting thing with this virus is that even condoms will not protect you from getting human papillomavirus. So the more types you get, the higher the risk that you will develop cancer of the cervix. Now, generally, there are things that are universal that will give you cancer of whatever it is. One of them I had mentioned earlier there is radiation.
Yes.
Radiation either from ultraviolet rays, from very strong sun, you will get something called melanoma. Radiation from medical equipment, repeated use of CT scanners, X-rays, mammograms, all those expose you to very high levels of radiation, and these high levels of radiation cause the DNA to break. Once the DNA has broken, the cells now will start dividing without any order. Yes.
Okay.
Then we have biological causes. I have mentioned the viruses. I have just mentioned the human papillomavirus, and it's associated with cancer of the virus. And there's a strain that is associated with cancer of the throat. And then alcohol, excessive consumption of alcohol is not good for you. Cigarette smoking is not very good for you. Cigarette smoking is associated with almost all cancers, be it cervix, be it throat, be it lung, be it nose. Cigarette smoking is not good because the cigarette as a substance has several elements, so to say, that are carcinogenic. Carcinogenic means that they predispose to cells towards aberrations in their DNA, and therefore encouraging their multiplication without any order. And then sedentary lifestyle, people become obese. We never used to have this problem before, but now Kenyans are becoming very obese. They are overeating, and they are not exercising well. So they have a high body mass index, and that alone will predispose you to cancer of the colon, cancer of the rectum, cancer of the breast, cancer of what we call hepatobiliary system, things like cholangiocarcinoma, which is cancer of the gallbladder, cancer of the pancreas. And then there are just individuals who are unlucky. They have inherited the genes that are unstable from their parents. We call this cancer syndromes. That's why you see small tiny children getting cancer, things like retinoblastoma. We have actually a gene that is associated with retinoblastoma, which is cancer of the eyes. So and so on and so forth. It is a long list. So you must have these factors coming together and a body that has failed to regulate that disorderly multiplication of cells. Then you develop cancer. Now once you develop cancers, most of the time these starts as a very small, tiny thing that cannot be seen. But with time, it multiplies. It becomes big. Once it has left something called the basement membrane, it can now leave the organ of origin and is spread through the blood to other organs. That's why sometimes an individual has cancer of the colon and they are telling you it's gone to the brain, what we call metastatic disease. And that is why we stage cancers. Because if we get stage 1 and 2 disease, it's a localized thing, we can do local treatment, actually with a possibility of cure. Once it has spread, it becomes very difficult to manage.
Okay.
Yes.
Okay. Now, thank you for that response. You have talked about radiations as one of the ways that one can get exposed to these cancerous diseases. Now, what about young children? Because in one way or another, you can find they can be exposed to X-rays, CT scans, maybe for medication purposes.
So now that is why in medicine we have something called the ALARA principle. As minimal exposure to radiation rays as possible. If you think a child, for example, has pneumonia, and you are 100% sure that this is a pneumonic process, you don't necessarily need to send the child for a chest X-ray. Always order radiation when you are beyond reasonable doubt that you need the test to confirm your condition or to refute the condition. That way you will give very minimal rays to your clients. But I want to assure the public that all those things are done within scientific confines. If you go to the X-ray stations in the hospitals, you will find some mark which is red, telling you that there is high exposure to radiation around that area. So science has been made such a way that we prevent you from absorbing rays as much as we can. Yes.
Okay.
So you've also talked about stage 1 and stage 2 being a localized thing and it can be controlled on an early stage. So how do you approach the diagnosis and staging of cervical cancer, breast cancer and prostate cancer?
Well, the diagnosis really, we say prevention, early detection, diagnosis and possible cure. Anytime you have something abnormal going on in your body, go and see a qualified doctor. For example, you'll find women with cancer of the cervix bleeding irregularly for a very long period of time. When at the first instance of bleeding or painful intercourse, they would have seen a doctor would have done something called a speculum and taken a sample of the cervical mouth and sent to the lab. There is a way the pathologist in the lab will look at that slide and tell us this one look like early cancer of the cervix, and you can go and your doctor can do for you something called conization or a lip procedure, literally excising that place where there is cancer. But you see, women will bleed. They will bleed 1 month, 6 months, 1 year, 2 years. They come to us when the cancer has left the cervix. Now it is in the abdomen or it is even in the lungs. Breast cancer is very easy to make, the diagnosis. And this one goes to women. Women learn your bodies, touch your breasts. It may not be 100% accurate, but it is not usual to get a growth in your breast. If you find a growth in your breast, please go and see a doctor so that you can be told if this growth is innocent or it is cancerous. So you look, observe, and if there's a reason, excise. Once you have excised, take to the lab. The pathologist will tell you what you have excised is this, and then come back and treat the patient. I would like to repeat that once cancer has gone to stage 3, 4, it becomes very difficult to manage, it becomes very difficult to control, and very expensive too. And the mortality is high. Yes.
Okay. Now, Moi Teaching and Referral Hospital, especially your wing, Chandaria, most people prefer, maybe across the Rift Valley, I think this is the largest cancer center. Now, how can you help those who are undergoing treatment in following the procedures, yes, seeking for medication? Because others maybe they think as maybe their culture, you know, what do you approach in, what do you tell people so that they can avoid cultures? Because other people depend, even religion, they can say there is no treatment for cancer. When once you have you are sick, come we pray for you, because those are the challenges that people are undergoing back in our reserves, in our areas of places. And number two, another question that I will like you to state it clearly is, does breast cancer affect only ladies, or it also affect men in this case?
Okay. Chandaria Cancer Center at MTRH is one of the best cancer outfits, not only in this country, but in sub-Saharan Africa. Why am I saying so? Is because we have the latest radiotherapy machines, state of the art. We don't have only one, we have 2 of them functional. We have a functional brachytherapy machine, state of the art. In fact, we do not have a waiting time at our brachytherapy unit. And what I mean with that is that if you came today with cancer of cervix, most likely if you meet all the conditions, you will be in our machine tomorrow morning for brachytherapy. For external beam radiotherapy, our waiting time now is 6 weeks, which is very impressive given that this is a public institution serving very many needy Kenyans. I always say, once they tell you that you have cancer and it has been confirmed, we don't stop you from praying. Pray as much as you can. You can even fast. But please follow the instructions that we give. Because you will pray, you will go to the herbalist. While you are doing that, the cancer is coming from stage 1 to stage 4. So eventually when you come back, when your tumor burden is very high in stage 4 disease, unfortunately there is nothing much we could do at that moment apart from support. But the system here is quite direct, very clear. The navigation is clear. When you come in here, there's a registration center. From registration, you go to the triage unit. Once you're in the triage unit, you are allocated your doctor, your appropriate doctor for that day. This unit works from 8 a.m. to 5 p.m. It is an ambulatory unit. Ambulatory means we see walk-in patients. Monday to Friday. So at any one given day, if you are booked, the doctor will see you. So people should not shy away. And there's also the notion that when you touch cancer or when you cut, then the patient is going to die. I would like to pose a question back to the public. If you don't touch your cancer and we don't treat it, don't you think you are still going to die? But if we cut your cancer, we take to the lab, we have a diagnosis, we will intervene. So it is better to take this other option. We are not stopping people from praying. We are not stopping them from seeing herbalists if that is what they prefer. Although me as a scientist, I will tell you, you are wasting your time with the herbalist. Come and get specialized treatment here. What was the other question? The question number 2?
The question was, does breast cancer, prostate cancer, and other cervical cancer affect only one gender, that is ladies?
Now, prostate cancer only affects men because only men have prostate gland. Cervical cancer only affects women because only women have cervix anatomically.
Yes.
Breast cancer can be found in men also. In fact, for every 9 breast cancers, 1 is a man. Yes.
Okay.
So what are the potential side effects and long effects of different treatment options for cervical cancer, breast cancer, and prostate cancer?
So there are those things you call side effects. The public will call them side effects. We call them adverse events. Adverse events is in that they are uncomfortable things that you must experience as you undergo treatment. Now there are those that you call acute, there are others that you call intermediate, then there are others that you call long-term, depending on if you are receiving chemotherapy or radiation therapy. The commonest effect that cuts across the board, whether you are receiving radiation or chemo, is that your white cell count can go low, your red cell count can go low, your HB can go low, and from time to time we can request you to bring people to donate blood so that you are transfused. Sometimes people develop sores in the mouth, terrible sores in the mouth. We call that mucositis, and that cuts across all. People can vomit, people can have diarrhea, people can have hair changes, your hair may fall off, you have nail changes, you can get nail discoloration, you can have your palms becoming discolored, most likely becoming dark. Now, long-term complications are things like fistulas, fibrosis. Fistula is a communication between one surface or another. For example, you have cancer of the cervix, then now you get communication between the bladder, which is the store for urine, and the vagina. So you have urine leaking through your vagina throughout. Or you have a communication between the rectum, where the stool is kept, and your vagina. So you have stool leaking in your vagina throughout. Those are long-term effects of treatment. Now people hardly talk about the emotional, sexual, and psychological long-term effects of cancer. Cancer as a disease comes with a heavy burden. Economically, people lose sources of income. Families actually break down. We've seen men bringing their wives here for treatment of cancer of the cervix, and we never see them again. Because you see now the cervix is sick, their sexual needs cannot be met, and yet this woman is taking so much family money for treatment. And then just the thought that you have a terminal condition lingering at the back of your mind, people are afraid. Even when they have in full remission, they are still afraid that they are going to die. So those are emotional and long-term psychological effects of cancer and cancer treatment. I'm not going to talk about the economic impact because it is huge.
Yes.
From diagnosis to treatment, it is huge. This is the only condition, where you are walking into the hospital, you are okay. The next moment you are being told you have cervical cancer stage 3B, we need to radiate you in this public hospital. If you don't have an NHIF, your treatment is going to cost almost 120,000. That's not common money for any common Kenyan.
Yes.
So the economical impact is quite huge. Yes.
So you talked about the fistula, maybe the leaking of stool through the vagina. So when we talk about men, does it affect men when you talk about the urine leaking through men non-stop? Does it also affect
the urine
men?
leaking through men non-stop from cancer of the prostate may not necessarily arise from a fistula. And oh yes, men can develop a fistula. I remember I told you fistula is a communication between two surfaces, to be precise, two epithelial surfaces. So for example, somebody could be having esophageal cancer and it has eroded, so there's a communication with the airway. We call that tracheoesophageal fistula. So it can happen in either sex, not necessarily a man or a woman. It depends on where in the body the cancer is and which surfaces are formed of a fistula.
Okay. Now, taking you back a little, you have talked about 4 stages. That is stage 1, 2, and stage 3. Now, how do you normally do treatment on each and every stage? Because maybe some of our followers have developed cancer and they have been tested, they know their stages, and they will wish to know how to undergo treatment on these stages.
Well, there is no one blanket treatment stage-wise. Each and every cancer has a way of treatment. And I'm going to summarize treatment as chemotherapy, radiotherapy, surgery, or multimodality.
Okay.
Multimodality means a certain type of cancer a patient may undergo surgery, and then after surgery they undergo something called undergo something called adjuvant radiotherapy, and then continue with chemotherapy. Yeah.
Okay.
That's multimodal treatment. It depends on the disease biology rather than the stage. Yes. But most stage 1 and 2 cancers are local diseases, can be treated by surgery or radiation depending on the cancer. Most stage 3 or 4 diseases are spread diseases, and we do something called systemic treatment by chemotherapy, targeted therapy. Yes.
Right. On the same, in some point you find maybe when we narrow it down to breast cancer, you find most ladies between age 18 and not 18 but 18 and below, they were given some vaccination in Kenya. Now, what has that vaccination helped in as the life progress?
What kind of vaccination?
Like you say, the Kenya, the Ministry of Health is championing for, I think, human papilloma.
Human papilloma virus
Yeah.
is the vaccine that we give against the human papilloma virus to prevent development of cancer of the cervix.
Okay.
Now, we will only give you this if you have not been exposed. And exposure means you not have any sexual debut. Whether you are a man or a woman. After that, your chances of getting human papilloma virus at the first sexual intercourse is almost 70%. So it doesn't make sense to vaccinate guys who have been having sex throughout. For these guys, we talk about screening and early detection. Yes.
Okay. Now, does age and relationship affect the probability of getting cancer?
The older you get, the more genetic aberrations you have, and the more your DNA support system is relaxed, and the more chances that you are going to develop cancer. Yeah.
So there is someone outside there that is having maybe cancer at the process of treatment, stage 1, stage 2, and someone has reached that stage 3 and 4. How do you maybe involve patients in the decision-making process regarding their treatment?
So, once we suspect that you are having cancer, we say malignancy in the medical cycle. We prepare you, we tell you, this swelling in your body looks like it can be cancerous. We are going to take a sample to the lab. When the sample comes back, there is something called disclosure. The doctor will tell you, like we were suspecting, it has been confirmed that you have cancer. Then the psychological counselor, who is better equipped with managing emotions and further explanations, will come to explain to you in details and reassure you. And then they'll send you back to your doctor, who will tell you you have cancer of the cervix 2B, which is a potentially curable condition. This is how we are going to go about your treatment. We are going to give you external beam radiotherapy with weekly chemotherapy and thereafter brachytherapy. That treatment is outlined very well so that as you go home, you know what to expect in terms of resources, in terms of time, in terms of the requirements. Yes. So it is, that's why I said cancer treatment is multi-speciality, multi-modality. We work closely with the nutritionists, counselors, we work closely with chaplains, occupational therapists, physiotherapists, and there are things called support groups. You know, if you have cervix cancer, we put in a support group of people who have cervical cancer so that you can exchange experiences and ideas. So it is a long thing. That's why I say it's a chronic thing. It's not a one-touch thing. Yes. In fact, we get so involved with our patients, we feel like part of that family. Yes.
So do we have such cases, maybe someone after being tested, he has been diagnosed with cancer 2B, like you've mentioned. We have such cases like someone maybe denies himself, maybe he denies even the results from the doctor.
Sure. Denial is part of the grieving process. It almost automatically happens. No one wants to accept that a bad thing is going to happen to them. So part of the brain protecting an individual is block that and say, I don't have it. Yes. So it's part of the grief process. That's why the counselor is there. Some people grieve shortly and move on. Some people grieve forever. And you have to accept that. People are different. Yes. So denial is part of the thing. And it actually what fuels going to the herbal way, going to the prayer way. Yes. So eventually when they come back, they are now used to their situation and they are ready to receive help. Yeah.
All right. Now, thank you for that response also. Now, following the interview, there is this question that one of our followers may be asking himself. Can you provide information on any support services that resources are available for patients and their families coping with cervical cancer, breast cancer, and prostate cancer may have?
I have talked about the support groups.
Okay.
In our institutions, we have them. Yes. There are channels that channel individuals to different support groups. And from time to time, we have incidences where survivors meet for support, exchanging experiences, and it usually is a very beautiful meeting to be at. Yes.
So you organize as a...
So we have channels. We definitely have support groups. Breast, cervix, yes.
Thank you.
So maybe how do you approach managing pain and addressing the quality of life concerns for patients with cancer? Prostate cancer and cervical cancer.
You know, pain, people normally talk about pain, but in cancer we have different types of pain. There is emotional pain, physical pain, even financial pain. You just be going around your business as usual, then they tell you, you have brain tumor. You have to undergo surgery. Your surgery will cost 300,000. And once you come from surgery, you need to be done for radiation. Your radiation will cost about 200 and something thousand. Money that you are not prepared about. So sometimes an individual is in pain, people thinking it is physical pain, but it is deep financial pain. Then there's the psychological pain of people fearing I'm going to die, leaving my family, things like that. That is a completely different kind of pain. Psychological pain, managed in a psychological manner. Then there is the physical pain. We have different pain scales. For example, you can say 0 to 10. 0 being no pain, 10 being a lot of pain. And they are managed in a staircase manner. If you have 0 pain, people just observe you and reassure you. If you have like 5 out of 10 pain, simple painkillers that you can even buy over the counter can assist you. Beyond that, we now give you things called opioid analgesics, morphine, yes.
So treating cancer is expensive. So
very expensive.
So does NHIF cover treatment?
Yes. Up to this moment, NHIF pays for most of cancer treatment in public hospitals. Yes.
Okay. Now, we have been having cases whereby patients are being recommended to go for medication maybe abroad, like countries like India and other places. What are some of the significance of them going there, and what do you normally use to see that we cannot manage this cancer at this level?
Actually, in this country, on 20th of March 2024, there is no cancer that is being managed in India that cannot be managed in Kenya. Yes. We have the expertise, even if we are few, we have the equipment. So you will hardly find us as qualified oncologists sending patients abroad. However, patients sometimes feel they need to seek second opinion abroad. It's okay.
So it's their decision that they are not satisfied with your results?
Almost up to 90% of those patients, it is their decision.
Okay.
I would like to go and get treatment abroad.
Okay.
Yeah.
So it's not that the country is not able to manage the cancer. It is their own decision.
Apart from few things like bone marrow transplantation,
Yes.
what have you, we manage most of those things
Okay.
comfortably without straining. Yes.
So how do you stay up to date on the latest research and guidelines for treating cancer?
Well, as a doctor, they say the day you stop reading is the day you start dying. Yeah, we always read, we go for it, we do research, we go for conferences to gain new knowledge from colleagues. Yes.
So, thank you for those responses. Now, as we approach the conclusion, what can you tell our viewers on how to manage these cancers, how to go about it, resources and the rest that may be thinking like, after you have been diagnosed of cancer, you are dead.
What the viewer should know is that the best way to manage cancer is to prevent it. Remove yourself from situations that can predispose you to developing cancer.
Yes.
And once you have got the diagnosis of cancer, don't spend too much time grieving. Accept treatment and follow the doctor's instructions to the letter. If you're not satisfied with your doctor, go seek second or even a third or a fourth opinion. Yes.
Okay.
And cancer, as much as some of them are terminal, now we say cancer is a chronic disease, manageable just like diabetes, hypertension. In fact, when they go to our clinic there, the line is very long. Some of those patients, we've been treating them for the last 5, 7, 10, 12 years. Yeah.
Okay. Maybe apart from biological, genetics, does hygiene and maybe balanced diet affect or cause cancer?
We had talked about that. Red meat is bad.
Okay.
Too much of everything is bad. Sugars, fine sugars, not good for you. You know, ice cream, sweets, chocolates, carbonated drink, not good for you.
Okay.
Always strive to do everything in moderation.
Okay.
Yes.
Okay. Thank you. Maybe you can add something before we conclude.
Maybe your parting shot as we conclude.
Parting shot is that listen to your body. Never ignore any symptom, however mundane it is. A very tiny black spot at the sole of your foot can be the beginning of a nightmare called malignant melanoma. It will not be painful. It will just be a black spot there, seated, relaxing. The next day, you are not breathing. We do a chest X-ray. We have what we call cannonballs. The melanoma spread from the feet to the lungs. Listen to your body, look at your body, and never ever ignore any small symptom.
Okay. All right. Thank you. It has been a good time to have you in our interview today, and we are looking forward to having you once any other time that we will seek. Maybe our audience may be following us, and they will seek for more and more interviews of the same. So I know that one time we will reach out to you again so that we can have you again in our interview. And thank you for your time, all our viewers, whenever you are. Continue following our channel, Fero TV Kenya. I want to also to accredit our technical team, that is Wanguchi, who has been our potential camera operator, and Edmond, our camera person also, and our doctor here, that is an oncologist. Also, encourage your students to go higher education, join tertiary institutions to pursue medical courses, so that we can have more like our madam here, who has enriched us with skills, enriched us with information concerning cancer. So thank you for your time. Have a blessed time.
So it has been a learning session. Actually, I myself have really benefited from Doctor here. He has mentioned something that if you see any slight change from your body, seek assistance from a nearby hospital for you to be checked up. Up in your post here together with Kige. My name is Collins Inito. Thank you.
Thank you. Have a blessed time.
Thank you.